Hi everyone, my name's Dr. Kat O'Neill and I'm a clinical and community psychologist. I'm going to be doing a talk today on community and mental health as part of Mental Health Awareness Week 12th to the 18th of May. So today we're going to cover a little bit about community psychology, which is an area that I'm really interested in. We're going to have a look at loneliness from what we call a socio-ecological perspective. So that's thinking about loneliness in its context. We're going to think about what does the evidence say about community well-being, and we're going to look at some examples from community practice. And the reason that we're looking at community and the reason I'm so passionate about this is because community is the theme of Mental Health Awareness Week this week. And I've been studying and working with communities for probably the last 20 years as part of my mental health career, basically. I think I'm really passionate about belonging, how we create that sense of social connectedness, how we make people feel like they're part of our communities and society. So community psychology is a bit of it used to be a bit of a fringe idea in psychology. It was something that was outside of the norm. A lot of psychology is focused on the individual, how the individual's feeling, and community psychology kind of had a bit of a different focus. So it was kind of looking at what was happening outside that person, not just what was happening within them, and how what was happening outside them affected them. So, for example, you might think about a person's family, a person's neighbourhood, a person's society, and thinking about how those external factors affects how that person is. It also has like a strong preventative focus. So there's a really nice diagram here, not a diagram, an image from Juliet Young, the creative clinical psychologist. And it basically is a quote by Desmond Tutu saying, we need to just stop pulling people out of the river. Some of us need to go upstream and find out why they're falling in the first place. So therapy is great, medication is great, meditation is great. These are all like useful things that individuals can do to feel better. But if there's things that are causing those problems or contributing to those problems that are wider than that individual, do we also need to be doing something about them to try and prevent mental health problems downstream? And so that's partly what community psychology is about as well. It's like saying what's happening upstream to that person. Is it poverty? Is it experiences of abuse and trauma, social systems, our education system, for example, that might be impacting on how that person's feeling? So this is quite an old book now, but it was a classic in its time. And it kind of talks about some of the values of community psychology that I think are really important. So as I've said already, there's something about that person in their own environment, and looking at their wider context. There's something about sharing psychology, so us not just hoarding that knowledge within our professional group, not that we do that, but it's about how do we get that knowledge out into communities where people can share it and use it for themselves. It's about partnership working. So anyone who knows me knows that I'm really into partnership working. I love working alongside voluntary and community sector, lived experience groups. I love planning projects together with other people. So there's something about kind of how we work with others to share expertise and ideas. It's prevention focused. Like I said, some of us need to be upstream thinking about how do we prevent mental health problems getting worse as a society. It's about including people from all different backgrounds and all different groups. So some of the podcasts I'm putting out this week will be about men's mental health, because I think they're in a group where there's kind of sometimes unrecognised or underrepresented in mental health services. We've also got other communities who might not traditionally be involved in psychology services. So it's how do we include them in the work we do? Thinking about issues of power. So how do power relationships, so if you feel disempowered, if you feel like you don't have power, if you feel like you're bottom of the pile, how does that impact on your mental well-being, and how do we support people to have more power? And I guess that links to this idea of social and collective action. So some of the stuff that I've been interested in that we'll talk about later is about how we empower people in their communities to take action. How do we support people to kind of make changes in their community, to develop their community through different initiatives and things. And it's meant to be transformative. So it's not a sticking plaster. It's not just, fixing that one person. It's saying, can we fix things bit wider than one person so that it affects lots of people? So one of the models, so a model is kind of a way of us understanding how things work and how they're structured. And one of the models that we use in community psychology is the ecological model called ecological systems theory. And this is an idea that an individual is within a context. And what the context looks like is we have these different levels of the system. The way I see it is like ripples on a pond. The person's the stone in the middle, and then the ripples come out getting increasingly further away from the person. So you've got the individual in the middle, and then anything that the individual directly works with, interacts with, is called the microsystem. So the microsystem might involve your peers, your faith community, your family, your workplace, your healthcare systems, anything that you like, people you meet up with, people you directly talk to or communicate with, is classed as your microsystem. Your mesosystem is how those systems interact. So how does your family get on with your GP, for example? If they say, "Oh no, we don't seek help, we don't go to the GP, we don't talk about our mental health problems," for example, then that might have an indirect impact on your well-being, because you might then think, "Well, I won't go and seek help because that's not what we do as a family," for example. Or if your peers have a negative relationship with your education, for example, or your workplace, then it might affect your relationship with your workplace and thus your stress levels or your stress levels around school and work. So that's the mesosystem. It's how those microsystems interact. We've got the exosystem, which is a little bit broader than what the individual directly touches, but it still can have an impact. So things like the media. So, sometimes we see that there's lots of fear information in the media about catastrophes and things that can happen. So that's going to potentially have an indirect effect on how people are feeling. It might make them more stressed, more anxious, for example. We've got things like our local policies. So, for example, it might not directly affect you by being a local councillor, but if you have local government and they decide to fund one service or not another, that can have an indirect effect on you. Similarly, what local amenities are available. So we know that Sure Start, which was during the 2000s, was a fantastic resource that had brilliant benefits for so many people in communities, starting from a younger age. And then unfortunately, we didn't have Sure Starts available, although I know they're now beginning to build family hubs and things again. But the availability of those local amenities could have had a net positive effect on a person, and then the unavailability could have had a net negative effect on a person. Then we've got the wider system. So the macro system is like the big society, not David Cameron's big society, but the bigger aspects of society. So things like our culture, some of the dominant ideologies in the society. So our values as a culture, some of the laws that we have, how's the economy performing. So, for example, if we're in a recession, that can potentially increase stress on an individual, which might make them more prone to mental health difficulties, for example. And then we've got the Chronos system, which is the final system, which looks at how over time values and attitudes change, and how that might directly or indirectly impact on people. So just thinking about like social attitudes towards women. Just as an example, 100 years ago plus, women couldn't vote, they couldn't do things independently, and that may have had a sort of potentially negative impact on their mental well-being. And then as societal attitudes have changed and women have become more independent, that might have had a beneficial effect on their well-being. I'm not saying it definitely is, but yeah, they could have done. So when we're thinking about people in context, one of the important elements is recognizing that social factors can have an impact on mental health outcomes. So it's not just about what's going on within us. There's also other stuff that's really important, and we call these the social determinants of health. So the diagram on the left is just a summary of some of the social determinants of health. So what this says, like, we as an individual have our own individual factors. That might be our age, our sex, our temperament. Perhaps some people are born more sensitive, some people are born more naturally resilient to challenge. We've got our individual lifestyle factors, which is kind of a small part of it. So we might choose to eat a particular diet or to use particular substances, to exercise or not exercise, for example, and that might impact our well-being. We've then got our social and community networks, which is an important part of our like health, our mental health and our health in general. So if we have good social support, if we have good community networks, that can be a benefit to our well-being. And some of these other factors include our food, the food that we've got access to, the level of education we have, what's our work environment like, is it supportive, is it stressful, is it very physical, etc. We've got living and working conditions. So some of the stuff we know is that if you live in poor quality housing, for example, where there's a lot of damp, that means you can be more prone to different health conditions, etc. We've got access to water and sanitation, which hopefully we've all got in this country at the moment. Whether you're employed or not, so we know employment can be good for health, not only because it gives people a focus and motivation, but it can also help financially. If you're not employed and you're under stress because of a lack of finances, that can have an impact on your health. Not to say that everyone needs to be employed, some people can't work, but having some sort of occupation in your life can be a beneficial thing. We've got accessibility of healthcare services, so are you able to get support when you need it, and housing availability and quality. And then we've got some general factors that might go into it. So, we know that these social factors can really have an impact, and that's kind of part of why we want to look at community in relation to mental health as part of Mental Health Week. So I wanted to focus on just one of those factors. So we looked at like social support, community, and social isolation potentially as the sort of converse side of that. And we know that when people feel lonely, when they feel disconnected from their communities, it can affect their mental health in a negative way. But also sometimes when people are living with mental health difficulties, it can also make them feel quite isolated or feel quite different to others or feel disconnected from others. So mental health and loneliness have a bi-directional relationship, so they can both feed into each other. And loneliness isn't just being alone, it can also feel like when you feel misunderstood or when you don't feel like you're part of something broader than yourself. And this was just some information from the Joe Cox Foundation. I love the image in the back, although you can't see it all. But it's just looking at all the different times where we might feel lonely. It doesn't discriminate. It can happen to any of us. It can sometimes feel a bit stigmatized, but certain life events or periods of life can put us at more risk of feeling lonely. So things like divorce and relationships, homelessness, leaving care, getting bullied, having a period of poor health. Maybe your children are leaving home, maybe you've had a bereavement, etc., becoming a carer. Lots of these different experiences can make us feel lonely. And there's an idea that it's as bad for your health as smoking 15 cigarettes per day when people are feeling lonely. And it can have significant impacts on mental and physical health. So, what works around loneliness? It might seem odd for a psychologist to be thinking about loneliness, and I guess that this is where this interest in community psychology comes in, because throughout the literature, we know that community-based intervention, so getting people more involved in the community, getting them volunteering, getting them doing stuff, can be really helpful around tackling loneliness and all of its negative mental health outcomes. The idea is that when we build communities where people can actually have genuine, long-standing relationships with each other, it's got a different sort of longevity than if we're just having those paid worker to service user dynamics, which can be helpful, but you're never going to be best buddies with your support worker, because that's not what the relationship is. That's not what the boundaries of the relationship allow. But if you allow people to get more involved in their community, start making a difference, get to know the neighbours or get to know other people in the local area, those relationships can be maintained much longer than any sort of paid professional relationships can. It also allows people to get a sense of being valued and being of value. So what we were saying earlier about feeling bottom of the pile, feeling like you're sort of excluded from society. Actually being able to be part of your community, contribute something positive, can give you a boost in your self-esteem and make you realise that you have value and something to contribute. And one of the areas that I'm really passionate about is asset-based community development and mutual aid. So mutual aid is where people with lived experience of a particular thing help each other. So some brilliant organisations locally that do this kind of work. So we've got Recovery Connections, Red Balloons, like loads and loads of peer-led organisations. But also asset-based community development is how do we approach communities and approach them seeing what assets are there, what positives are there, rather than like what's wrong or what they don't have, basically. So there is a recent systematic review that was saying these kind of wider community approaches can reduce loneliness, and that can have a knock-on impact on people's mental health in a positive way. So, what does the research say about involving community members in wellbeing initiatives? So, one of the things that's important in this kind of space is the idea of co-creation. So, this is called co-creating community wellbeing initiatives. So, how do we get community members themselves involved in the creation of wellbeing initiatives? And Powell in 2024 looked at all of the research evidence on this topic and has created a summary here. It's called a systematic review of the literature. So some of the things that they said was important. Some of it included community alignment. So when you come to a community, you have to think about the needs, the strengths, and the history. You can't just come with a preset project that's worked somewhere else. You can't necessarily just come with your ideas as an expert unless you get to know what's important to that community and what resources are within that community. So an important part of this work is always like building those relationships, building those connections. We also have a sense of ownership from the community, so we want to encourage bottom-up approaches. So a recent example of something we've been doing is a community micro grants program with a grassroots local organisation where we've given them small grants to do some participatory work that's based around their own priorities that they're interested in. So, we want to empower people to make change themselves and have a sense of ownership over it. We need to include the community in any strategy that we're developing and build trust with them. Because lots of communities might have had kind of negative experiences with organisations parachuting in and then disappearing and not kind of creating something that is of lasting value to them. We also need to kind of develop a sense of shared purpose, shared values. What is it that we want out of our community wellbeing projects? How do we kind of do something that's meaningful to both the community and ourselves? We want to do collaborative action, so we want to build partnerships between organisations. So, for example, we were putting in a large-scale funding bid last year around setting up a disability research network in Hartlepool, and as part of that, we worked with local voluntary sector infrastructure organisations, very small grassroots organisations, members of the disability community themselves, and we kind of thought together about what that research network might look like, what its priorities might be, how it would work in practice, and all of that was built through our sort of partnership and shared working and shared decision making. Other things are around transparent communication. So it's important to know that, we need to be upfront about how the project's going to work. Maybe something's gone wrong. Sometimes things do go wrong, but maybe timescales get delayed. I work in academia, you might work somewhere else. But often, we might have things that hold things up. So it might be that we have to go to an ethics committee before we can do anything, or we have to make for certain decisions and things. So, but I think the main thing that's come through to me from some of the participatory work that I've done is that people don't mind if there's delays as long as you can talk to them about it and explain. So I think communication is absolutely key, and that's what builds that trust. There's also continuous learning. So we can all have great ideas and come in and do some wonderful stuff, but do we know that it works, and how can we prove that it works? So, doing some monitoring, doing some qualitative stuff that's around people's stories, people's journeys, but also maybe doing some quantitative stuff where we look at outcome measures and evaluate the activities of the project so we can take forward the ones that actually work. We've also got resource management. So we need to think about finance. It's a reality that a lot of these projects, we did a community micro grants program in my community, which I'll tell you about in a little bit. But, while we were doing that, you can't do those projects on nothing. They might be, some of them can be very low cost, but we need to have resources in place. So it's not enough just to come in with a strategy, have some money that communities can use to benefit them, and that they can use for projects and things like that. So, for example, on the microgrants program, it was part of a community transformation program with the local NHS trust, and we got £5,000 that went out in terms of community microgrants. People set up things like a male sea shanty choir, we had a youth club, crochet lessons, community meal, um, like a screening of a local film. So that these ideas came from the community. They bid for the money. It got voted on by the community for the best projects, and those got taken forward by community members. So having the resources available is a key part of that. Otherwise, people won't be able to action the projects. So we're going to go through a few different examples of practical ways that you can implement some of these ideas around community development. Asset-based community development is one of the areas that you might want to have a look at if you're interested in taking more of a community approach. I can highly recommend Cormac Russell and his company Nurture Development, who've done a lot of work taking a strengths-based approach to how we work with communities, looking at what assets and resources are there and looking at how we get people involved in making a positive change. Nurture Development's work is based on an idea that we should do things with communities and we should empower communities to take action themselves so that the change is being done by communities rather than doing things to communities or for them, which is, it's not the most helpful approach when we're working with them. When we're doing stuff with people and in partnership, when we're doing stuff where they take the lead, change is much more likely to be sustained and based on genuine relationships rather than lots of projects which can be very time limited, and run out of funding and disappear as soon as the funding is gone. One of the programs we've used for gathering community feedback and ideas is Padlet. I don't know if anyone's used that before. It's like you can add post-it notes to an ideas wall for your community. So anyone can add those ideas, and then the community members can upvote them using a thumbs up, and then the best ideas end up coming to the top. And it's a really helpful way to kind of say, what changes is it that you want? And then people can vote on what's being suggested. So again, it's like, how do we pass power back to the community? One of the ideas that got taken forwards in the community that I lived is basically alleyway greening, where community members could get together, make the alleyways look a bit more beautiful, a bit more interesting after there was a lot of antisocial behaviour and the dumping of things like mattresses and others in the alleyways. So that's just a nice idea of where an idea has come from the community, they've taken action, they've taken it forwards, other people have decided to get involved, and then something has changed within the community, but it's been empowered by them. And this is a lovely bit of feedback from one of the projects that I was involved in previously. This was to do with the COVID helpline that we set up, and we had a lot of older people who couldn't leave the house because they were shielding, but they actually ended up running our helplines for us so that people could get support and get access to shopping and resources. And one of the things, and I think it like really sums up why a community and asset and strengths-based approach matters, because those people could have been just recipients of that service, but they wanted to give something back as well. And in the giving, that gives something to them. And this was just one of the things that somebody said, I've been able to feel needed in my old age. And for many people, having that sense of purpose, that sense of belonging, giving them something, an opportunity to make a difference in a genuine way is so beneficial no matter what age people are. So the take-home message from all of this work working with communities is, let's do something, let's make a positive change, let's work together for community benefit. Let's think about how we can offer power to others, because we know that it has an effect on well-being. We know that belonging can be really beneficial for mental health. So this Mental Health Awareness Week, think about how you can engage with the community, think about how you can reach out to the resources that are there. Can you get involved in volunteering? Can you get involved in getting some ideas going, thinking about making a change? Great way to kind of meet people, share ideas, get excited about things and make a positive difference whilst doing so. So I hope you all have a good week and thank you for listening. Bye.